If you're sitting far, far back in the back of this huge hall, please feel welcome to come up much further up front. We want to make this very different. This is your lunch hour. It's very precious, and we're already past the halfway mark of this conference. Everyone's a little tired, everyone's a little lethargic, but what we're here to talk about, of course, is innovation. So the very reason we are tight, let's spruce up the energy a bit if you want to come forward, because we will be asking you to ask questions. We want this to be completely engaging, we want this to be completely interactive, and we want this to be innovative in itself. Joining us first on my right is Michel Kazatchkine. Of course, he needs very little introduction except to say that he is the executive director of the Global Fund, and of course funding and concerns about the retreat of that has been a huge concern all the way from the political leadership all the way through to the community activists, as of course we saw them right here when they took to the stage just before the opening ceremony. Thank you very much to Michel for joining us here from Geneva. And on my left, we're also very, very thrilled to have you here. You're so busy. It's very hard to get in contact with you. But Philippe Douste-Blazy is, of course, the chairman of the board of UNITAID, and we're thrilled that you can be here. Having Philippe Douste-Blazy and Michel Kazatchkine together here on the stage, and hopefully being able to move that conversation forward, will bring us all together as we try to see what the future of funding is, not just the future, but what the now is of funding. So let's talk about innovative financing. Now, this section is called Funding Global Health. Can innovative mechanisms save the day? My first question is this. I looked at the title, and the first question in my head was, what do we need to save? Does a day need to be saved? Michel?
Yes, the day need to be saved because we need continuous and increased funding for health. We need increased funding to fight AIDS, TB, malaria, for maternal and child health, for health system strengthening, and to move the health agenda. And clearly to me, in 2010, innovative financing is not just a timely question. It is a necessity. It is a necessity for financing reasons, and the financial crisis, the crisis in the Eurozone recently, that is putting more and more pressure on official development aid, and the ability in the future of governments to sustain at high level their commitments as compared to what the needs are, certainly puts innovating financing as one area that we strongly need to engage into.
But let
me just also say that the other advantage or added value I see to innovative financing is that it is bringing together all of the partners. It is bringing consumers in some of the examples, it's bringing the private sector, it's bringing the government, it's bringing the multilaterals. So it's also building the type of multi-sectoral consensus that we want to be behind health. Sorry, James, for interrupting.
I did want to add there, because right now in this room, we've got, I don't know, a few hundreds or maybe a few thousand people right here. You're preaching to the choir. Now, if you came onto my TV show and you said, we need to save the day because of X, Y, Z about HIV/AIDS, we're going to look back at you right away and we're going to say, well, what about climate change? What about water conservation? What about conflicts? How can you justify AIDS in a day and age, and I'm not arguing with here, but how can you justify to the wider world? Because it's not just the 25,000 people here. You need to convince the political leaderships who in the past haven't been on the side completely. What are you going to do to really show them that the day really is worth saving?
Well, there are two things I'm saying. First, let's not enter into the debate whether it should be AIDS against health systems or AIDS against maternal and child health. We just need funding for health, and we need funding for all of the global issues that this world is facing. What I'm saying is, in terms of health, we have made a very strong case. If you look back the last 5 years, we've been able to start from nowhere, basically no one on antiretroviral treatment, for example, 5 years ago. And contrary to whatever people were speculating and saying, it's 5.2 million people on treatment today, so that what we call universal access is not some sort of elusive concept out there. It is reality. We're on the way to be able to achieve it. And I think we have made a very strong case of actual feasibility. So that's the one thing. And then, again, let's not oppose one area to another. And when we talk about innovative mechanisms, when we think about what a tax such as the Robin Hood tax could bring, this is really about something that could help us fund development in general and thus help us politically in a globalizing world.
Of course, I don't think everybody really truly understands what innovative mechanisms really are. Perhaps we can go a little deeper into that. Philippe Douste-Blazy, could you just explain to us the concept of innovative mechanisms and how that relates back to HIV and AIDS?
Yes, first of all, I want to say that we have to ask heads of state to increase the ODA. It's the first thing. Second thing is to understand that it's not possible to reach the Millennium Development Goals and the health-related MDGs, and particularly the MDG 6, only with ODA. And as Michel said, it's very important to create new sources of financing. The definition for me of innovative financing are financing which are additional, predictable, and sustainable. Yeah. The reason why in 2005, 2006, we began with a small levy tax on plane ticket. Nobody thought that it was possible. But now, 3.5 years after, we raised $1.5 billion, and we work on AIDS, tuberculosis, and malaria, and particularly with Global Fund. I think that we have to change the scale, because only 40% of the patients with HIV are treated. It's the reason why, as Michel said as well, we have to change the scale. To change the scale, I think that we have to understand that there are 4, 5 economic activities which have benefited a lot from the globalization. It's internet, mobile phone, financial transactions and banks, and tourism. We began with plane, but now we have to set up a tax on interbank transactions of exchange. I think that it's very, very important because it's feasible, economically feasible, technically feasible, and I am sure that we have to explain to heads of state during the next MDG summit in New York that we have to fight here together to obtain the currency transaction levy in the conclusions of the MDGs summit. And after that, we are going to have the G20, which is, and France is going to be chairing the G20. I think that it's very important to fight for the currency transaction levy as for poor people, for developing countries. It's a new, for me, innovative financing for development.
I was just when you were talking then, you used one word which just stuck out, and obviously it was sustainability. I think it's very, very important to think about not just innovative mechanisms, but how do you balance that with the existing mechanisms, the traditional ones that are already in existence. It simply is obviously not about just discarding them, but it's in complementary balance.
Absolutely.
In addition to
what Philippe said is absolutely essential. Innovative financing mechanism should not save the day by substituting for official development aid. And I'm actually worried that the 0.7% target of GNP in terms of ODA that the world has set to itself and the United Nations asked member states to adopt, that this target is constantly pushed back. More than ever do we need a strong ODA, and I'm particularly concerned about the impact on the crisis, on the ability of the countries to scale up their ODA. And I think it's really the minimum that the world can do, that the rich world devotes 0.7% of the GNP to development. And as you know, currently, most of the countries are somewhere between 0.16 and 0.45, except for the high standard that the Scandinavian and many Nordic countries have set, being above 0.7%, often somewhere around 1%. So innovative funding is clearly an additional funding, and it's saving the day by helping us adding up, not substituting.
Talking about that, because there is this genuine fear amongst people, amongst activists and amongst leaders even, I'm not sure if you're one of them, that people do see it as a substitute. They do see it as, government leaders thinking, well, they're being innovative. There's a plain levy tax. There's no need for us to stick to our bilateral governmental agreements anymore. Are you seeing that? You have your big replenishment conference coming up in October. Are you seeing countries beginning to shirk their responsibility by looking towards innovative financial mechanisms as a way out, not for the world, but as a way out for themselves?
At this time, I can't say anything about our replenishment. We still have 3 months until the MDG summit.
Compared to 2007, July 2007 compared to July 2010, what's the difference? Is it black and white, the difference, or is it quite similar?
July 2007, we were on the eve of getting to a replenishment of $10 billion for 2008, 9, and 10. This year, we're coming to the donors and saying if we want to respond what we anticipate will be the demand from countries, we need a 17 billion at least replenishment in order to have those countries continue scaling up at the same pace at which they've been scaling up in the last few years. And that's what we need in order to move to the health-related MDGs. We're saying the countries have proven their ability to scale up. If we were to have the resources, we could really come close to a world without malaria deaths by 2015. We could save millions of lives with HIV life-saving treatment. We could virtually eliminate mother-to-child transmission of HIV, as we've been discussing here in many sessions. Now, I'm also hearing at the same time from the donors, we're really under severe budgetary constraints. And that is why we have to push on every front. We have to push on ODA. We have ourselves to look into how much efficiency gains we can show further to the donors, showing that everyone is making its effort. The developing countries themselves and African countries have to stick to the Abuja targets, and we have to push for innovative financing mechanism, which is the topic of this particular discussion. And I'm very strongly behind that push.
You telling me that government leaders come up to you and I know that you crisscross the globe literally. God knows how many countries you go to in a single week, and I bumped into you in Beijing of all places a few weeks ago. I'm sure government leaders come up to you and they say, yes, we've got budgetary constraints. Of course they're going to say that. And the financial crisis is a perfect excuse for all that. But they seem to have money to bail out banks. In my country, they send people up in rockets and so forth. There is money around.
Yes, well, let's be very clear. Decisions on funding, such as funding health, are political decisions. And politics, and here we have a politician with us, Philippe, political decisions are about choices. And at one point you have to make choices and say what your priorities are. And what I think Philippe and I are saying is that development and health in development are and should be priorities for the world.
Of course, they're speaking to a former French foreign minister. If you were currently French finance minister, what would you say to that? Michel Calestine comes up to your office, knocks on the door and says, we want more money for the Global Fund because we want to save lives, for AIDS, TB, malaria. And if you were the foreign minister, not just of France, but of any country or of an international organization, to say there was a world government, what are you going to say to him?
Your question allows to me to answer and to come back to the currency transaction levy. Why? Because you have in the world each year $900,000 billion between banks only for exchange currency transactions. 97 of these transactions are from speculation. It's absolutely not linked with economy, the real economy. It's only speculative between banks. Take, for example, the euro. All the transactions for euro go through one chamber of compensation. We know very well it. And you already have a small percentage, 0.00001%, which is for the electronics, use. If all the head of state around the table of European Council decide to take 0.005%, it's painless. At the end of the year, it's 20 billion euros per year. And you can, save millions of lives, and you can reach the MDGs, 6 probably, more easily. I think it is a political decision. It's not a technical decision. It's possible. It's not an economic decision. It's possible. It's only a political decision. The problem is, 5 years ago, non-heads of state thought that it was possible. Now, everybody around the table of G20 know that it's possible. The problem is, where goes the money? Some Minister of Finance said, the money is for the new risk of a new crisis for banks. Or Minister of Finance can say, I have no budget, I have a lot of deficit of debts in my country. I am going to take this money. The fight here in Vienna is to explain to head of state that this money is for developing countries. For me, it's a key for the peace in the 21st century.
Thanks, Philippe. Michel?
Yeah, I just say there are two political decisions. There are two political decisions, and first political decision is move into a financial transaction tax that, as you said, Philippe, is now accepted and has been shown to be technically feasible. Yeah. And the second political decision, and that is important for everyone to understand, is that at this time, as we see a positive move towards the tax, we're still not sure whether the money from that tax will indeed go to development, and particularly to health and development. So that's the second political challenge.
Let's go back to, you mentioned G8 just there. I mean, last month in Muskoka, the G8 stopped short of making any new financial commitments for AIDS or Africa. So if the G8 is not stepping up to task at hand, why aren't they asking the financial sector to support the Robin Hood tax?
You have two possibilities. If you take all the financial transactions in the world, you have to go through the financial bankers. If you decide this only for the currency transaction levy, you can decide at the political level, country by country, not country by country, but currency by currency. And for example, I am sure that if the European Council vote in favor of a currency transaction levy, I am sure that 1 week after, the Prime Minister of Japan can say yes for yen. And why not in the US? Because I cannot think that it's possible for one head of state to say no, because it's possible politically.
I just missed out just there because we're having this great debate. You mentioned Abuja just there. Of course, Abuja is a commitment made by African leaders to spend 15% of their budget on health. Of course, this includes HIV. But this commitment has not been met by most countries.
Well, commitments from the North has not been met either. So, and far from, we are somewhere at 60% of the Gleneagle commitments, and we're way into 2010 now. I think it's fair to say that we have to share the burden and everyone has to contribute. And the ministers, the heads of states of Africa committed in Abuja to have 15% of the budget devoted to health. That is to politically show that health is a priority for these countries. It's not the absolute amount of dollars that this will generate, which is important. It is the political significance that meeting the Abuja targets will carry. First political significance, I consider health as a priority for my country. Second political significance, I'm showing that I also want to make an effort and to make difficult budgetary choices in my country, just as I'm asking difficult choices from the donors.
Of course, Michel Sidibé himself said as part of Treatment 2.0 that health isn't a luxury. Health is very much a necessity. Zimbabwe was one of the only countries to ever introduce an AIDS levy, something like a national AIDS tax, so to speak. Why don't more countries follow this example, and how high does that prevalence need to be before countries must resort to such measures?
Well, that's the Zimbabwe example. Yes, indeed, it's one of the I'm just trying to put my thoughts together, but that's the only country I know at this time that has a specific AIDS levy that is contributing to the budget. Let's also be clear that Zimbabwe is heavily relying on external sources of financing to finance its AIDS, TB, and malaria programs, and primarily on the Global Fund that remained the only funder at the times when Zimbabwe was and still remains to a large extent under a severe embargo. I just see this is one of the mechanisms, and the 15% Abuja target is another one by which countries can show their political commitment to health as a priority.
Just something that just came to mind, because I wanted to get you back into the main conversation again. Why doesn't UNITAID give all its money to the Global Fund?
What?
Why doesn't UNITAID give all its money to the Global Fund?
Sorry. No, is the question why UNITAID isn't putting in? Sorry, no.
I'm staying out of this.
UNITAID is there to serve the countries. Yeah. The Global Fund is there to serve the countries. Yeah. UNITAID is not there to help the Global Fund. UNITAID, Global Fund, bilaterals, foundations, everyone is fighting together.
UNITAID is, it's not on the ground. UNITAID can, we have an expert group in UNITAID, and we decide each year which kind of programs we are going to help. And for children with HIV, for example, it's Clinton Foundation, or for the eradication of the HIV from the pregnant mother to the newborn is UNICEF. For malaria, we work with, as well, Global Fund. I want to, you give the floor, and I want to say that, for me, innovative financing is not only innovative funding, but it is as well innovative spending. Or, we have to create new ideas with this financial capitalism. The example is the wonderful, the amazing presentation of Hélène Thun this morning about patent pool, because, it's absolutely abnormal to see that when we do progress in Western countries, when we create new drugs and medicines in Western countries, we have to wait 10 or 15 years to have the same medicine or the same drug in developing countries. It's absolutely unfair. It's the reason why we created, with United, the first medicine patent pool foundation. It's an initiative of United to allow developing countries to have, at the same time, the efficient, safer drugs in the world with a small price. I think it's a key. It's not funding, but a new manner of thinking, you know. And I am very delighted to see that the beginning of negotiations are now. And I hope that at the end of this year, we will be able to say to you which companies has accepted voluntarily to do a patent pool. I think it's very important to do a license because it's a problem of intellectual property. We cannot continue with the same intellectual property rules. If you take the agreements, TRIPS agreements between India and European Union, 90% of drugs or medicines in Africa and developing countries are generics. 90% of generics are from India. And now, because we have these agreements, it's not possible we are going to see a big problem in developing countries for generics. It's absolutely impossible to continue with these politics. It's the reason why we have to create new ways, and it's very important for me to see that the French government, the UK government, Brazilian, Chilean, Norwegian, Korean has accepted to do that.
I just wanted to stay with you just for one quick question over here. Of course, Massive Good has drawn a massive attention in the media as the latest innovative finance mechanism. It asks people to give a few dollars or even just a few cents when they book an airline ticket online. What is the IATA, the International Airline Agency, doing to make such an airline tax mandatory instead of just asking countries to do it voluntarily? And does the European experience show, the good European experience show, that if people can afford a plane ticket, they can afford to pay a tax too on top of it, just a small one even?
Yeah. When we create United and the small, painless plane ticket levy, we thought that it was possible to go to the US. And the administration, or Bush administration, said to me, it's absolutely impossible to speak about tax in this country. And I say, but I am French. I know that tax is not a big problem for us, but $1 or $2 by plane ticket, it's painless for you as well. It was impossible to move forward. It's the reason why we decided to create a voluntary solidarity worldwide contribution. Why? Because each year you have 2 billion people which buy a plane ticket through internet. Either because they buy directly on their laptop or because they buy through travel agencies or airlines companies. But at the end of the day, it's only 3 companies, Amadeus for Europe, Sabre in the US, and Travelport as well, who are 3 global distribution system, big informatic engines, who are responsible for these 2 billion people who buy a plane ticket. I saw the 3 CEOs, and particularly the CEO of Amadeus in Europe, Philippe Chérec. He said to me, we can work on a software to ask every traveler in the US or in Europe, in the world, do you want to pay $2 more when you buy a plane ticket? If you say yes, you click here. If you say no, you don't click. In the US, we thought that it was possible to launch in March 2010. We have a delay because Sabre, the global distribution system in America, wanted to have 6 or 8 months more. We are going to launch operationally this voluntary contribution for the next Thanksgiving. Massive Good in America. It's a reason why we don't have so far clicks, but we are going to have clicks after Thanksgiving. We launched Massive Good in June in Spain, and it works because now we have a lot of clicks in Spain. I think it's very important, you know, with internet to allow each traveler to give $2 for developing countries, and particularly for HIV/AIDS.
Michel Kazatchkine, I wanted to ask you also, and we will get back to Massive Good because I really do want to go back to that in just a second. But of course, the world celebrates the patent pool, but the drugs, of course, at the same time still aren't free. Instead of just lowering the prices, shouldn't we invest more money in keeping patients on first-line therapy, which is 10 times cheaper than second-line therapy? What is the Global Fund doing to keep the cost of HIV treatment to a reasonable minimum?
Well, firstly, the Global Fund is the largest buyer of these drugs in the world. So by creating a market, we're also, and by having the demand and creating the market, we can diversify the offer, and therefore we can help decreasing the prices. The prices have decreased drastically, as everyone knows in this room. In Durban 2000, the cost of antiretroviral treatment first line was $10,000 or more per patient per year. The cost of these drugs, the average cost that we currently pay, that if I take all of the HIV grants that we finance in over 120 countries, the average cost is $120 to $150 per patient per year, and the cheapest regimen we finance is $85 per patient per year. However, when it comes, but that's a regimen which is a fixed pill that everyone knows here, with 3 drugs that are not including some of the best drugs that we would wish patients to benefit from. And when it comes to second-line drug, our average current price of our first second-line regimen is $1,200 per patient per year. But some of these drugs are actually 20, if not 40 times more expensive. So I fully agree with what Philippe said. You know, we cannot go on with the current intellectual property rules, and this is why I really fully support the concept and the efforts around the pool patent.
I think I spied your deputy, Dr. Zodin. She's somewhere in the room, isn't she? That is you. I think I saw it. She's extremely good at timekeeping, and I'm not. So I'm really going to ask for very quick answers over here, because I have so many more things I want to get at. Philippe, if there is a Robin Hood tax, who should manage it? Should the Global Fund handle something as big as this, or do we need an alternative funding body like a Robin Hood fund?
Yes, but just before I answer your question, I want to say to Michel that I completely agree with him when he spoke about the reduction of price. And United, for example, during the last 3 years, with the partnership of CHAI, the Clinton Foundation, has cut the price of second line from $1,500 to less than $600. I think that it's extremely significant and extremely important. The next 3 years, and because of the work already done by United, by CHAI, by PEPFAR, and the Global Fund, will benefit at least $300 million savings because of the price reduction United has negotiated developing second-line market in developing countries. I think it's very important, and I would like to ask Michel what is thinking about that.
I'm sorry, about the...
You know, in the next year, what do you think about the reduction of the price?
I'm fairly optimistic that on 1 or 2 specific second-line regimens, and for example, the regimens, and of course, primarily the regimens on which Chai has focused, we will see further reductions in prices. And over 50, I think it's close to 60% of our grants are currently using those ceilings. And when we buy, because we also fulfill for some of the countries when they ask it from us on a temporary basis, when we also act as a procurement agent ourselves, when we do what we call voluntary pooled procurement for countries, we use the China-negotiated ceilings as the absolute ceiling above which we wouldn't accept to pay a given price for a drug. So I expect those prices to come down. But I would like to see the prices of many more drugs to come down. And so one step at a time. But when it comes, and I'm sorry here, I'll talk about a specific drug, when it comes to Kaletra and to the new forms of Kaletra, I would indeed hope that we see further reductions very soon.
And my question?
What is your question about?
The question about that if there was a Robin Hood tax, I mean, who should it go through? Do we need to set up an alternative funding body just particularly for this? I mean, what would be your advice?
No, you know, I think that the key for this tax is to convince during the next session of General Assembly in the UN. We have to convince head of state, first of all, the European Union, but as well the Prime Minister of Japan, and just after, Hillary Clinton and Mr. Obama. Because I am sure, and the President of China, I am sure that when we see the difficulty of because we need a lot of money to reach the MDGs, we need $150 billion a year. We have now 110. It's absolutely impossible to reach the MDGs by 2015 without innovative financing. But it's not only with UNITED, it's a small laboratory of innovative financing. We have to create this tax. This tax, politically, it's feasible. And I am sure that the key is in General Assembly of the UN, after that in G20, and after that during the European Council, the next one in October.
Michel?
Yeah, can I just say two things here? One is, I really support what Philippe says, because this is an urgent matter. We cannot wait for these innovative financing mechanisms to be functional in 5 or 10 years. Our current, we should be able to scale up access to treatment and prevention and care now. When it comes to how much of the financing mechanisms we will need by 2015, let's also not forget, this brings us back to the debate of ODA, that if the rich countries would have fulfilled their Gleneagle commitments, we wouldn't be where we are today. So there are two things again. We need the donor countries to keep their commitments and bring the ODA, and in addition to that, we need to implement the innovating funding mechanisms as soon as possible. So all of that requires strong political commitment and strong political move.
James, please. One thing. I think that we saw in Copenhagen a big failure, a political failure. Because each head of state said, first, we don't have money from ODA. Second one, we have to create innovative financing. But it's too easy, you know. Which one? Which one? And as Michel Kazatchkine said, we have, 3 months to define exactly which one. I think that the currency transaction levy is a big opportunity. And we have 3 months, or 2 months, you know. It's feasible now.
I just want to ask you, everyone in the room, who here would call themselves a young leader, young activist? 1, 2, 3. Obviously targeting the wrong people over here in this session. But I went to your website, and I thought your website was fantastic, and I saw the celebrity endorsements, and I think that it really does speak to young people. It really does engage, and when they see people like will.i.am, and you have these great little like YouTube type videos there, it's cool, it's sexy, and much more than anything, it's appealing. So much of innovation these days comes from young people. I mean, we just came from the launch of the High-Level Prevention Commission just unveiled by UNAIDS. Chris Hughes, one of the co-founders of Facebook with Mark Zuckerberg, is on there. So a lot of innovation is coming from young people in our world. But at the same time, the very same young people are crying out that there aren't enough innovative funds for supporting young people and for supporting HIV in a whole. Will the Global Fund and will Massive Good be willing to commit to earmark 5% for the future to support and to empower young people, to support and empower the very people who will be leading us into the next generation?
Well, first, let me very clear. I was here, 48 hours ago. I'm now a bit confused with my own schedule. Yeah. But on this very stage with young leaders participating in the youth session, and I really heard the passion, the energy, the commitment, and I'm strongly supporting that advocacy, and I'm absolutely convinced that youth has to play a key role in the future of prevention and access to prevention particularly. And the Global Fund has no restriction whatsoever here. But the Global Fund will never commit to say 3% or 5% or 10% or whatever, because the way the Global Fund works, it's not a top-down organization. I think the times when the donors were deciding for the others what the others should receive, those times are over. The way I see development, the way I think we should all agree, and we all basically agree, I know in this audience development should take place, is that it starts with country ownership. And it's for the countries to decide on their priorities. All of us are willing to support and help the youth to become a stronger voice on what we call the CCMs, that are the entities that require for the funding to the Global Fund, and to have more room for funding youth organizations and youth efforts in the fight against the 3 diseases.
I know, Michel, that a lot of people do like you personally, but there must have been a huge endorsement for you when you were sitting here that day and your picture was flashed up by the young people from Ukraine and Russia, elevated to demigod status.
The young people from Ukraine and Russia, you know, are going through hard times. Yeah. The epidemic is rapidly increasing there in young people, and they have lots of difficulties to have their voices being heard.
We got a couple of minutes, so very, very quickly. Michel, I was wondering, could you just open up your jacket and show people what you're wearing, please?
Okay.
Okay, I'll just lift this up for you. This is another inspired, another Red product over there. I mean, Red is just one of the many examples of cool kind of products that have been very much in the media limelight for many years. I want to go back to what you were talking about, Philippe, there. You know, Product Red and Massive Good. There's a lot of hype, there's a lot of rhetoric, there's a lot of hot air, some people say. How much money is really being raised by innovative financing like Product Red or Massive Good? And I have the numbers on Massive Good.
No, it's very difficult to say. The problem is the branding. The problem of Massive Good, for example, it's very difficult to succeed a very good branding. For example, UNICEF, everybody in the world knows UNICEF. How we can organize advertising for Massive Good or for Red, for example, is with U2, and it's easier because you have big celebrities. I think that we have to organize, advertising campaign, but we don't want to give some money for communication. It's very expensive, and we have to organize, an advocacy campaign with celebrities. You said a few minutes ago about, you spoke a few minutes ago about will.i.am, for example. Mm-hmm. It's a very good example because it's for free. But every young people, young man or women, knows will.i.am, for example. But it's very difficult. And to answer your question, I think that if we succeed, if everybody in the world, every traveler in the world knows the name of Massive Good.
Yes. I mean, they do know the name of Massive Good, but I also read a newspaper article the other day, and forgive me if my numbers aren't quite down to the dollar and cent over here, but they said that Massive Good has spent $11 million in promoting campaign. And how much money have they raised? Was it something just under $14,000? Yes. People say that's a bit of a crime.
Yes, exactly.
Is that yes? You are admitting that it is?
No, because we are in United, the board of United, all the governments. And we decided to develop a new innovative financing is a voluntary contribution. And to develop the software, to develop the Massive Good initiative, we need money, and we decide to give money. But, is in each startup, it's the same thing, James.
Yeah.
You spend money during the first year, and after that, you have the money back. And for example, when I said to you a few minutes ago that the first click in the US is going to begin only after Thanksgiving, we cannot have a click now. The reason why it's very easy to say they spend the money, but they not have money back because we have not begun in the US,
I just had this sign flash up saying 5 minutes remain. So I want to ask one quick question of you, Philippe, that I must squeeze in, and then I want to ask Michel about some concluding thoughts over here. One of the big stories, as a journalist, one of the big stories of this week, of course, is funding. The other big story is the Caprisa study yesterday. And the other big story is Treatment 2.0, which Michel Sidibé unveiled a couple of days. It is being seen by some people as the future of treatment. How will patents play for better access to treatment and goods in our future?
For me, the key is a patent pool. For me, the key is to organize a new relationships between holders of patents and generics. I am sure that it's a key for the future. We can't continue only, because the problem with the capitalism is how we can provide global public goods for 1.5 billion people in the world. We have to create innovative financing for funding, but we have as well to define new rules, political rules, for the capitalism about education, about food, about public health. And I think it's a key.
Okay, we're going to be very democratic over here. Because we have very few minutes left, I want to think about what's the one thing that everybody in this room can do. What's the one thing that we can do? What's the one thing that we can do to make innovative funding work for each one of us? I'm going to ask one person in the audience. I'm going to ask you, and I would love Michel to finish up. The one thing that you can do to make innovative funding work for everybody, and you can go first, but it has to be really quick, in one statement for you, and then I'll find someone in the audience. You can go first. Philippe? One idea as to how to make innovative funding work for everybody. What's the one thing that we can take away? Okay, I'll find somebody else first. Who's the first? Okay, first person to put up their hand over here. What's the one thing that we can do to make innovative? Relarqué. I love you because you spoke so beautifully yesterday, and you push the cause of funding. What's the one thing that we can do? Stand up.
Innovative financing?
Yeah.
Let me be provocative and say that we have to go back and ask ourselves, if we're looking for money for healthcare, what's happening to our systems? They're all underfunded. We don't have healthcare workers. Where are our healthcare workers? Where I come from, I went to school free of charge. Except you went to a private university in my country, tuition is free. But where are all our doctors? Where are our nurses? Where are our professionals? They're in the countries of the north. So footballers pay billions to swap people in clubs. Can you do the same thing? Can you give back to the countries that are investing in training these healthcare workers that are across the globe? One. Number two, I'd like to see tax on scratch cards. Okay, they say we have universal access to cell phones, so let's tax these guys. Let's get money from scratch cards. I'd also like to see some tax on oil and gas. I'd like to see tax on banking, which means that there is money in our economies. It's just a matter of who controls them. And like has been said, it's a political decision. It's the people who are close to power that controls these industries, and there's zero will. But really, we must tax you guys that are taking our doctors and nurses.
Just one thing. You're talking about political leadership there, weren't you? The point is that you are speaking to two leaders on the stage right now who are in a position to make real change. What's the one thing that you would tell them both?
Michelle, please don't ask for 17 billion. 20 billion is what we want for the Global Fund. That's the minimum we want. Please stop asking for 17. It doesn't do us good. We want the very optimal best. And for United, we'll say patent pool, yes. Obviously, if we cannot afford to get second-line drugs, then we're sunk. We had first line a few years ago. Some of us are failing first line. For those of us with HIV, it's absolutely important. Our children are dying because they have no access to treatment. And we really must ensure that ARVs are affordable and that we can pay for them.
Thank you very much. Response from you both. What would you say?
Well, first let me say, Rolake, it's not a matter, it's 17, 20, over 20. What you and I and all of us want is that we have the funding necessary to answer the demand from the countries. Maybe the demand will be 25. So I think what we want from a replenishment and from a global fund in the future is that it is capable of answering the demand. James, you wanted me to say a few things here?
Yes.
Okay.
Please go ahead and just say.
Thank you. Just 2-3 thoughts from this debate. 3 points. The first is that we need a strong push on innovating financing, because not only because we have urgent and large needs in health, but also because innovative financing is really contributing to build the sort of global citizenship and global solidarity effort involving all sectors of society, involving rich countries, but also the rich people in poor countries in a global effort. The second, and that was a strong point from the early part of our debate, in no way innovative mechanisms for funding should substitute for ODA, and all of us have to keep the pressure and the advocacy on having the commitments from the donors fulfilled. And third point, all of this is urgent. People are in need of treatment, prevention, care and support urgently. So the first emergency is have at the United Nations Summit in September this year, both the leaders commit to ODA and to public money going into health and development, and second, the leaders commit to implementing a tax on financial transactions, and then commit to have the funding from that tax go into development and not to once more into saving the banks.
Okay, Philippe, last words here.
Yes, I would thank the word about the taxation, because I think that it's very, very important for tomorrow to have the courage to give a micro-solidarity contribution for the developing countries in the world, and particularly with the global activities which benefit a lot from the globalization. And I am sure that it's possible to organize at the global level a global taxation for poor people, to provide public goods. The second thing is the example of plane ticket. If you can explain, convince each government that it's absolutely painless for a traveler to pay $1 more. It's not the price of a coffee. Nobody knows exactly how costs a plane ticket. It depends on the oil, the price of the oil, the airlines companies, etc. We have to do that for two reasons. First, it's money for United, and after that for partners. And the second is, you know, the beginning of a new thinking about the global citizenship in the world. Thank you.
Unfortunately, our time together is up over here. So I think what the takeaway message over here is that obviously there's so much to do, but obviously the world and we as a world can't afford to miss the opportunity being offered and being gifted by innovative financing. Let's go out there, not just be a Robin Hood, but go out there and be a Robin Good. To my guests, Michel Kazakstein from Global Fund and Philippe Douste-Blazy from United, and to you, for all of you, for being here today. Thank you very much. Goodbye.
Thank you, Tim.